second part of today on creative and impactful civil society advocacy. Shh. Thank you. We are going to start with a presentation by Alberto Vasquez, who's president of an organization called Society and Disability, SODIS, in Peru, which I'm happy to say has been one of the grantee organizations of the Disability Rights Fund, as well as a grantee of Open Society Foundations and other donors. And we will move after Alberto's presentation to question and answer, and then go to a presentation from Georgi and Tamar from the Coalition for Independent Living in Georgia. We will do both of these presentations before the lunch break at 1. So I'm going to invite Alberto to begin his presentation. Thank you.
Good morning, everybody. It's great to be back in Galway always, as a former student. It's hard to talk about the process in Peru on the civil code so many times without repeating myself, but I think I have some new developments for those that already has listened about this process. I have added some lessons learned that I think could be very useful actually for debate. But what I'm going to do now is to present the campaigning for the reform of the civil code and legal capacity in Peru, and for some background context for people, just to know where is Peru located. Peru is located in South America. It's a presidential democratic republic. We have 30 million population, so it's a fair enough big country. According to the National Disability Survey, we have 1.5 million, but to be honest, we know it's underrepresented, the population of persons with disabilities. We have a new legislation on persons with disabilities, a new general law on persons with disabilities since 2012, and it's a civil law tradition country. And that's very important to understand how important is the civil code in terms of recognizing legal capacity. I'm going to present first what is the proposal civil society is pushing on the reform of the civil code. We are almost there, but we're still facing some challenges in getting the law approved. Then I will try to explore the strategy we have used to get to this point, and then I will try to get some lessons from the experience. It has been a long process. So the situation on legal capacity in Peru is we have a civil code, and as most of the country from civil law, it declares the incapacity of a range of people, not only persons with disabilities, but also drug consumers, people who has problem with gambling, and technically the civil code says alcoholics. So there is a whole range of people that could be deprived of their legal capacity. And it's a very straightforward status-based approach to legal capacity, which means if you have an impairment that is listed in the civil code, you may be able to get a guardian. And we have a guardianship system that doesn't make so much difference in terms of plenary guardianship or partial guardianship, because at the end it's normally applied as a blanket situation. So normally most of the people that get a guardian will be deprived of all their civil and political rights. The proceedings are also not in line with the convention, so access to justice is denied when you enter the procedure to be declared incapable. And the civil code goes even beyond and specifically denies other rights of persons with disabilities, such as the right to marry, or denies the right of parenting. And the biggest issue, and I think we share this with many developing countries, is not just the law, it's the practice. We have de facto deprivation of liberty in every single formal institution. So governmental offices, administrative offices, will interpret the civil code in a way that you actually don't need to be declared incapable by the judge, because it will be presumed that you are incapable just because you have an intellectual, a psychosocial disability. So that's kind of the situation person with intellectual and psychosocial disabilities, and of course autistic person, face in Peru in terms of legal capacity, a widespread deprivation of legal capacity. What we are proposing, and when I say we, is actually not only my organization, but a group of organizations working together as a working group to achieve a law reform on legal capacity. We're proposing a full recognition of the capacity and using the words of our tradition in the civil code, in the Peruvian civil code, to hold rights and to act rights, which means full legal capacity in terms of the convention. And this proposal has been already written. We have a bill now that is being discussed at the Congress, and the proposal recognizes that. Full recognition of legal capacity, elimination of guardianship, and all legal restrictions for all persons, not only for persons with disabilities, but also for other groups. And then the proposal, the bill we are discussing, propose different types of support measures. This is not necessarily a support measure, but it has been framed like this: accessibility and reasonable accommodation in every service to guarantee legal capacity. Advanced directives, which now the civil code has only for older persons, and actually leads to deprivation of liberty, because it's a way to ensure who is going to be your guardian. But in this case, what we are proposing is advanced directives to secure how it's going to work and who is going to be your support network. We're also proposing, following the Canadian experience, support agreements. And then finally, the proposal has an exceptional judicial appointment, but this judicial appointment is not to get a guardian or, a support person that acts as a guardian, but actually is a support system that will be reviewed through the judicial system to determine what is your will and preference, and taking this as a point of departure. How should look your support network, but involving the person in the procedure? Because it's very clear in the law that, in the law proposal, that a support network, a support measure cannot be imposed to anybody. So there is no requirement of support measures also for being legally independently, which means if you choose not to have a support system in place, you still can argue that you will need reasonable accommodation to exercise your right to legal capacity. And then if somebody denies you to exercise your legal capacity, then we will have a case on discrimination. So if you are following me and you are aware of Article 12 of the Convention on the Rights of Persons with Disability, this is a very progressive proposal in terms of implementing the convention. There is also a small safeguard system that is included in the proposal, which is we have to ensure in every type of support measure the respect of the will and preference of the persons, some time limits, and periodical review. This is a charter. We worked to do the advocacy. We used to work the advocacy, which actually identified the type of measure we're proposing with the expected impact we have on each of the measures. So when we think about accessibility and reasonable accommodation regarding legal capacity, we are thinking more about persons with low support needs. And that was quite easy to sell in terms of, even to politicians to understand why it's so important to ensure that measure. And I would say reasonable accommodation has been one of the measures that has been supported more during the process. Advanced directive, we were thinking more about progressive impairments, and also persons with psychosocial disability that may benefit. Of course, it could be more open, but the expected impact, or the most important impact, will be in those groups. In terms of support agreements, families and persons with intellectual disabilities were very strong advocating for this, because it provides a way out of the judicial system to get support. And the idea with support agreements is you don't have actually to go to the judicial system. You can go just to a notary and register a support agreement. And finally, the judicial appointment, it was kind of an exit way to the discussion how we deal with the so-called hard cases, how we deal with those cases when a person has been institutionalized so many years, has no family networks, how we deal with those cases. So this is the judicial appointment is a way out of those cases, but at the same time, it keeps enough safeguards to keep ensuring that the will and preference of the person should prevail. This is the proposal. This is what we want. What is the situation now of this proposal? We have a draft produced by the Congress Special Commission on Legal Capacity of Persons with Disabilities, which was the commission working on this. And the commission was integrated by many entities of the state and civil society, through representatives of civil society. But for us, the most important, the draft was supported by the judiciary, the ombudsman person, the National Registration Office that is very linked to the exercise of legal capacity in Peru, and the National Council on Disabilities. So we had great support during the process of those organizations. And then the proposal has been discussed already in two standing commissions, the Commission of Justice and Human Rights and the Commission on Social Inclusion and Persons with Disabilities. We expected to have the proposal approved on those commissions in these first 6 months of the 2016. We couldn't achieve that. And actually, at some point, as I will explain, we actually blocked the process of voting the proposal because at some point, the Commission changed the draft as we wanted. And I think it's one of the lessons I would like to share with you in terms of how you deal with the political system to ensure these kind of processes. But the proposal has been already discussed in two major commissions, especially the Commission of Justice and Human Rights is the most important commission in the country, in the Congress. And probably the next step will be we will have to deal with a new Congress. We had elections this year. We have a new Congress coming in July 2016, and so we expect that the draft, no, it's not a draft, now the bill will be tabled again by the political party that supported the bill at the beginning, and we will have a new discussion on those commissions. So this is kind of the situation of the process now. I think the most important part for this is the strategy. So how we ended with a bill that is supported with the judiciary, many entities, and civil society to go forward on the implementation of the right to legal capacity in Peru. And we were working since 2009 with the support of Disability Rights Fund, Open Society Foundations, at different fronts. And to be honest, this is not a cohesive strategy. This is more, we discovered this was working at the moment, at the right moment. We were improvising a lot, we were adapting, we were changing the strategies a lot. But from the beginning, we knew we needed to work with the Congress, with the judicial system, with academia, with civil society, and with media, with the support of international cooperation. And that was clear since 2009. In 2009, SODIS, the organization I worked, and other DPOs in the country, we started a process of law reform on disability rights in the country. And as civil society, we managed to get a citizen initiative that requires in Peru around 4,000 signatures to present a citizen initiative. We got more than 100,000. And at that moment, we thought, should we include the reform of the civil code in this omnibus law we were trying to pass, or we should separate those processes and just first get new legislation on disability, and then we move forward to the civil code reform. And Catalina de Bandas was working at that moment with Disability Rights Fund, and we had a long discussion on this, and it was the best at that moment with the knowledge we had and with the expertise we had in terms of advocacy that just focused on the general law on persons with disability. But that was a key decision, because at that moment we decided at some point we want a law reform on the civil code. How we ensure that? So the general law on persons with disabilities included a provision ordering the Congress to create a special commission to review the civil code on legal capacity, and we were capable to frame that commission. So we, in 2009, thought who we want to be sitting in this commission. Of course, you cannot avoid the judiciary, you cannot avoid the Ministry of Justice, you cannot avoid so many entities that are important in the process, but we also wanted to ensure that the ombudsman person will be there, that civil society will be seated, and the whole commission will be framed around the CRPD. So that was important for us. That was a key strategic decision made many years in advance. But then to follow up that process, we really needed full-time engagement. So we have been working full-time, even with a parliamentarian focal point, going after every single congressman in every single commission that was involved in that process. So we kept really good contact with not only with the parliamentarians, but also with the staff working in those commissions, that at the end, those are the ones making the decisions of the text. We were working very closely also with the political parties to get the support of those commissions. But then, to move forward, we needed more at the Congress level. So last year, for instance, taking advantage of a meeting of the World Bank in Peru, and of course that Catalina is close to the disability movement in Peru, we had the Special Rapporteurs on the Rights of Persons with Disabilities, a member of the CRPD committee, and a representative from the International Disability Alliance sitting at the Congress with a joint session with both commissions just discussing the law reform on legal capacity. Civil society made all the arrangement to get that session, but the fact that we had such authoritative voices at the Congress discussing this, that really made a change. So last year in October, we had that session, and in November, we already had a draft positive opinion for both commissions to go forward with the reform. So that meeting was key in terms of advocacy, because having such authoritative voices really opened a window for speeding up the process. With the judiciary, that has been very supportive of the law reform, we worked since 2009, at the beginning with the support of Open Society Foundations. So we did several training courses with the Judicial Academy, as SODIS, as an organization, on disability, on the rights of persons with disability, but later, specifically on legal capacity. And that was also very positive in terms of impact inside the judiciary, not only because judges will be able to have new tools to apply the convention at the national level, but also because they will advocate inside to support this kind of process of reform. So those training was 10 weeks training. It was a diploma, actually. They will get accreditation for the Judicial Academy. People will enroll on those trainings, not only because we ensure international experts coming to this training, but also because the Judicial Academy will give them credits to advance in the career. So that was also very positive. And then some of the judges of the course advocated for a circular letter. That's something that's very common in the judiciary when they not agree on something, and because there is no hierarchy. So sometimes the president of the judiciary sent a letter to all the judges saying don't forget that this right could be interpreted in that way. This article of the Civil Code could be interpreted in that way, and we have jurisprudence on this. It's not mandatory to follow those letters, but at the same time, it's a good practice in terms of, at least at that moment, to limit in the scope of the guardianship, to make the judge to think, we really need a guardianship in this case, or what other measure could be taken with the current legal system. And then because of this process with the judiciary, we got also the opportunity to do some strategic litigation. We got in a very good case with a judge that actually repealed the civil code and applied directly the convention in a couple of, now 5 cases related to legal capacity. So the judge received 5 different requests for guardianship, and he ended in the sentence saying, I cannot apply this because it's against the Convention on the Rights of Persons with Disability, and we should explore new ways to implement support measures for those specific cases, and at the same time calling the Congress to speed up the process of reforming the Civil Code, because this is really making the judiciary to come out with responses that maybe should be taken at the Congress level. Academia was also very involved. As SODIS, we pushed for some diplomas and training courses around 2009 with one key university in Lima, the Catholic University. After that, the Catholic University got involved with Open Society Foundations, and now they have a legal clinic. And they helped a lot also in terms of engaging key lawyers, especially on civil law, to support this process. And finally, civil society was very active. As SODIS, we have a board comprised of persons with disability, but we act as an NGO, so we work together with many DPOs, especially with the Down Syndrome Society, which is the biggest organization on persons with intellectual disabilities and families, but also with one key DPO of persons with psychosocial disabilities. In the photo on the slide, there is 3 persons from Alamo, which is with the main organization of persons with psychosocial disabilities. And we all together, we created a working group. We will sit in a restaurant, in a cafe, and we work for hours just drafting the text of the proposal we wanted and discussing next steps. So it was a very enlightening process in terms of those groups never worked together before, and it was the first time sitting all together and discussing really the grounds of the reform. We came out with some principles, and then we tried to involve other disability organizations and human rights organizations. It wasn't easy. There is this idea that law reform of legal capacity only involves persons with psychosocial or intellectual disability, which is not true, but at the same time there was a lot of resistance from the umbrella DPO and other DPOs to get involved with the process. At the end, now they're joining the efforts because they see the process is going forward, but at the same time, at the beginning, it was very hard to engage with them. And with media, we also work in a big campaign of how we tell the story of the law reform without going back to the issue of you just have to implement the CRPD. And I think that's a key issue, how you communicate to the broad audience that legal capacity is an issue that actually cut lives, that stop people their dreams. And it was very effective to take persons with disabilities speaking up, telling their stories, how deprivation of legal capacity is really hurting their lives and how it's stopping. For instance, in one case, one of the pictures in the top is Brian Mujica. He is the first person with Down syndrome in Peru that finished university, and he was facing the fact that he couldn't create he couldn't start a small business because he couldn't register himself, the business, at the notary because he had no legal capacity. according to the civil code. So this type of stories were very effective in gaining attention, not only for the Congress, but also from general audience. We have still to work in many more issues to get where we want. This year, we're starting some training with legal aid services because we realized that the Ministry of Justice has these legal aid services, but at the same time, these legal aid services were the ones promoting guardianship to access some social benefits. So next month, we're starting a small course with them, 4 weeks, just to train them to find different ways to ensure access to social benefit without going to guardianship, which was the regular work they do. They had like 500 cases in the last 3 years. Then we need to work more with families. We're exploring the way to work on community-based experience to how to provide support actually and how to build networks. And we have the support of Open Society there, and we hope to implement a new project on that. But there are a lot of things pending. I just want to go to the lesson learned. It was a long process. We started in 2009 with the general reform. Then in 2013, we really started with the specific process on the law reform on legal capacity, and we're still waiting for a final answer at the Congress. We're still waiting for the adoption of the bill, and we're waiting for see some change also in the grounds. And I think one of the first lessons we got is think long term. I think it was really good to think at the beginning, this is going to take a lot of time. And it was good because we really set a clear strategy for our objectives. It's going to take long, so we have time to try to work with the judiciary, we have time to work with the media, we have time to work with different stakeholders. And it was good also because we were thinking long term, we were able to set some principles with other stakeholders to say, this is where we want to go. Otherwise, you have the risk, I think, at some point to get lost in the discussions. But also to be patient. This year, we were really impatient in terms of we want the Congress to pass this now because we're changing the Congress, and we don't want to go to a new Congress and to start again with the process. But then it was better to wait, and I think it was a good decision at some point. The Commission of Justice was about to adopt the reform, but with some key changes we didn't want in the proposal because it was a mix between ensuring support measures, but at the same time keeping some space for guardianship. And as civil society, we really opposed that, and we thought, okay, we have been waiting like 3 years now, we can wait more time to get it done right. Build partnership was also a key lesson, and I cannot say this enough, but too much is never enough. We were 3 organizations at the beginning, now we are a bigger coalition. We have the support of many umbrella DPOs, which is good, but it's not enough. We need the support of the private sector, we need the support of other key stakeholders. And there is, this I think is an African proverb, if you want to go fast, go alone, but if you want to go far, go with others. So that's the way we're trying to work. It hasn't been easy, to be honest. I think we could have done this more in a more participatory approach, but it was hard to engage with all the stakeholders. And I think at some point, when you are successful in something, people will keep joining your efforts. And we felt that at the process. At some point, we felt that we were working against humanity in Peru. But then we realized that when we were going forward, so now you have a commission, now you have a bill, now you have the bill table in the Commission of Justice, people thought, okay, this is the time to join efforts because it seems it's happening. And that's very positive also in terms of using that as a leverage to get more people on board. Know your enemy. We faced that recently. you have to identify all your stakeholders, including people that will be against the reform. And they won't speak up easily, because you don't want to say, I'm against the rights of persons with disabilities. But they will, at some point, put some pressure in the key stakeholders to block your reform. And just as I said, we had the bill table at the Commission of Justice. We had the Special Rapporteur and other people speaking up at the Commission of Justice. The Commission of Justice, just 1 month after that, had a draft positive opinion on the bill, which means it was adopted, that will be easily passed through the Congress. And we were waiting for the final adoption. It was also bad luck because of the elections. Meetings never concreted, so we were missing a lot of meetings. But then at some point, just the last session, the president of the commission changed completely the draft. And changed completely the draft because there was this key civil law professor doing advocacy with him to try to keep guardianship. And which is amazing for me is it was a very conservative professor that at least at some point decided we can go for support measures, we will keep guardianship. So I think even with that, it was positive that even him will open the space to discuss some support and some alternative to guardianship, but at the same time, you can see that you cannot trust that the process is going well up to you see that the process has ended, which was quite challenging for us. So never underestimate an enemy, because at some point they will trigger all the possibilities they have. And I think this proverb also is very useful: keep your friends close and your enemies closer. And it was very useful with some law professors. We worked with them from the beginning, and they were against the reform at the beginning, but then they kept thinking about, and I think at some point pride comes first for some people, and the fact that they will be the expert on the law reform process in Peru, and they saw this was coming, so they started writing about that. And and after you get published, you become an expert on the issue. And then know to sell your proposal. I think we haven't been able to communicate effectively the process, because at some point you don't want to accept simplicity. We talk about rights, we talk about the CRPD, we talk about legal capacity, and then you talk with somebody from media and will say, legal capacity, nobody will understand it. So let's think again, what is the key issue that is behind that? It's about making decisions, maybe. It's about liberties, maybe. It's about equality. Yeah, but to be able to communicate effectively, you have to sometimes renounce your legal discourse to get into more in touch with the basic principles that are behind the reform. And I think it's very challenging for many of us, especially for us lawyers, to live the legal discourse. And media could be a very strong ally. They look for stories. They need to publish. They need to publish something that will be worth it to be read. And if you do the work, and if you find the right story for them, if you write all the content they need, they will use it. And that's the kind of work we learned, that we had somebody just working on that, creating these stories, and then just giving it to media. Do you want this? This is very interesting. This is happening. And then most journalists will say, sure, the work is done. This is a great story. I can publish it. So it really helped. And I think, and I like this phrase from a book I was reading the other day, the ones who distrust in excess of rhetoric is because they trust too much in their truth. And I think we have to put ourselves in the position again to explain why we need a law reform on legal capacity, why we need to implement Article 12. We keep saying it's because the CRPD says so. No, we need to build all the arguments behind that. And I think there is not enough explanation we can do on this. Politicians are just politicians, so don't get mad at them if they don't want, if they don't agree with you or if they don't want to pass your bill. I think they make complex decisions because they have to agree with a lot of constituencies. And I have been working in the Congress for a couple of years, so I kind of understand the reasoning behind many of the decisions, because interests and agendas change constantly. So what was a priority today is not longer tomorrow. So it's very hard to keep something in the agenda for too long. So I think we need to engage more in understand how the political process is not the same as a technical process. I think we think about, and sometimes we even dream about, governance from technocrats, but we need politicians because they are the ones that will make decisions when nobody agrees on something. And this is kind of the issue we're facing. Article 12, do we agree on how we want to implement a law reform on legal capacity or support measures? And I think that's something we have to take into consideration when we discuss with them. But at the same time, don't be naive. So we were naive. We thought the process will continue, but at some point, the president of the commission just changed his mind. And changed his mind because we weren't very aware of our enemies of the reform. So there are kind of lessons. It keeps coming to me. And then finally, because I know I have time, adapt. Adaptation is key in advocacy. It's key in politics, but also in advocacy. And I like this phrase, politics is the art of the possible, the attainable, the art of the next best. So we have to make sense of opportunities. And timing in politics is crucial, because then the agenda will shift. And we learned in the process when to fight and when not to fight. We wouldn't fight somebody just because he spoke against the reform. We will sit with the person. We will try to engage with the person. We will try to understand what are the fears that are behind. And after that, if it doesn't work, well, we may fight. But we will be very conscious that we need more people in the room all the time. And the most important, have a backup plan. What happens if at some moment somebody pull out a different text? So we had a backup plan, so we literally blocked the votation. So 3 days before the votation of the final draft and the Commission of Justice, we called all the congressmen we could to ensure that they will ask for withdrawing the whole reform on legal capacity from the general reform of the Civil Code, because it was part of the reform. So they withdraw that. Despite that, the president of the commission kept the text saying, no, you withdraw the text of those parts, but we want to go forward with this reform. And because of that, we also ensure that a lot of congressmen will put a lot of reconsiderations of the voting, so we technically block because they didn't have enough time to vote again and to vote again all the reconsiderations. So we finally abort the mission at last time, thinking, okay, in 3 months we have a new Congress, we can start again with the new Congress. And we had, since the beginning of this year, been engaging different organizations with all the political parties running for the Congress and running for the president to ensure that they will keep the law reform on legal capacity as one of the priorities. So we had a backup plan that was, if we don't achieve this in this Congress, we should get ready to work with the next one. So that was kind of our backup plan. Thanks for your attention.
Thank you, Alberto. That was excellent with the lessons learned. I really appreciated that. I especially appreciated the be patient and don't go for the reform that is not quite what you want. We have a lot of grantees who say, oh, but it's better than what we have. Even if it's not quite perfect, it's better. But when you look at the long term, and you are looking at a process where you may have to make yet more amendments in the future, that actually may take longer. So I really appreciate the long-term view and the be patient. Before we go to the presentation from Georgia, I would like to open up the floor for some questions for Alberto.
Reasonable accommodation for persons with disabilities, persons requiring mental capacity is only applicable to low support groups. Is that what I heard correctly? If there can be more clarification on this.
We're going to take question by question.
No, the idea will be that will be open. That was kind of the expected impact of that measure, but to be honest, it's going to apply for everybody. So the idea was just to ensure reasonable accommodation in the exercise of decision making. But it will be open. No, it was just how we sell it in terms of reform.
Thank you. I think in your presentation you highlighted that initially you had challenges in taking on board some of the members from the disability movement. Maybe just to highlight, how did you handle that scenario? Because I remember in one of the presentations yesterday, it was also raised to say one of the challenges amongst the DPO is that some would not participate. And in your reforms, I just want to understand where all the different impairments were represented in the reforms, or you were focusing much on one type of disability, because that in a way also leads into division amongst the DPOs to say maybe the reforms only focused on one kind of impairment where the other ones are completely left out. If that was your experience, I thought that's also one of the good learning points from you. Thank you.
At the beginning, we started working, especially 3 organizations, mostly focusing on persons with intellectual disabilities and psychosocial disabilities. Then we tried to open the space to include, and we include more mainstream organizations working with different type of person with impairment. But it wasn't easy. I think the fact that most of the umbrella organizations in Peru, they don't include both persons with intellectual disabilities and psychosocial disabilities was an issue. That was an issue that was taking them out of the process. We kept trying. We kept trying. At some point, as I said, because the process was going forward, they decided to be more engaged, and some of them from some key umbrella organization became even the front speakers for the reform, but it was a long process to engage with them.
So we had one in the back. Yes,
In the middle or in the back? Far back.
Hi, thanks Alberto, that was a really fascinating presentation. I just wanted to ask about civil servants, because I don't think you mentioned them as maybe someone that you worked with a lot, and you were more focused on the parliamentarians. And this was a challenge we experienced in the Irish context, particularly where even if the parliamentarians would put forward whatever argument we wanted once they trusted us, but then they would say, do you really want us to press this? Because if we do, you still have to work with the civil servants afterwards, and if you make an enemy of the civil servants who draft the amendments in the end, then it's not worth it. So I just wondered if you had that kind of challenge in your context. And the other thing I thought was really interesting was about the long-term strategy, because we were very conscious that we might want a long-term strategy, but also we have to plan around the political cycle, which is not a long-term strategy, and then that we cannot predict what the next parliament will look like and who might be allies in the next process. So that was definitely a challenge for us, but also when there are long gaps. So in politics, things happen very quickly and all at once. And so between those very quickly and all at once, there can be a long gap of inactivity, and how you manage to use maybe those periods to plan and prepare and decide what to do next. So in our context, we spent a lot of time waiting, expecting the bill to be published this month, next month, the month after, and we didn't use that time effectively, because every time we thought it's coming now, and it didn't come. And if we'd known we have a year, we would have done a lot of things in the year, but we kept thinking we have a month, we have 2 months. So just wondered if that was something that happened.
About civil servants, we engage a lot with the civil servant at the Congress level. They were very aware of the process. We even built some personal relationship with them, so we tried to get them engaged, and that was very positive. That's why the first opinions from the commissions were very positive, because the civil servants working those opinions were on board. It was different with civil servants from other ministries, but we have to understand that in Peru, so we had a number, is around now probably 8,000 or 9,000 people under guardianship. So it's not a big thing. Most of the people is just a presumption of incapacity. But in terms of guardianship, there is not so much. So because of that, and then the guardianship system just rely on families. So you don't have civil servants involved as service providers, which is good in terms of the strategy, because you actually have to deal more with families rather than with the civil servants that are going to lose their jobs because of the reform. But it's important to think, we were really thinking, even during the design, what the judicial system want. And it was quite clear from them that what they wanted is less cases. And with the law reform, they realized that I like this. We don't have to deal with all the cases, only with the hard cases, and it's going to be a different approach, but still it's less work than before. And then with notaries, they realized that, oh, this is a good opportunity, because we will work on doing all these support agreements, and of course, that could be a risk, because in terms of the cost, but we ensured that we had 2 ways. So with the notaries, and also the free one with the judicial system, but not in a contentious process, but just a registered process. A lot of time waiting, true. And I think that was kind of the part of be patient. At some point, things speed up, some points stop. But that's a political process. So you never know what's going to be the agenda. So you have to be all time engaged. So we will have each Monday to review, each Thursday, we had to review what is going to be the agenda of the next Tuesday. And we had to react in that period of time if we had a new text coming. And it's a very short notice to work, but that was the only way you get engaged with the political cycle. In the long term, it's easy, but then when you get into the position that you could have your bill debated next week, people get tired. So people get tired of going to the commission, thinking this is at the top of the priority, it's number 1 in the agenda, and then it's not discussed. Next week, it's not discussed. And then at some point, people say, I shouldn't go, it's not going to be discussed, and then they discuss it. It's difficult. You have to be full-time engaged.
Thank you. Bruce, and then we had one there.
Yes, so I thought it was an excellent presentation on your work. And I have a question, because I don't know the legal system in Peru. In Russia and in post-Soviet countries that adopted the legal systems of Russia and under the Soviet Union, many disabled persons were given up to orphanages and put in orphanages because they have a disability, and not because of mental incapacity. And they also would lose their legal capacity inside the institution. And they then become adults and they only have a physical disability, but they, under the law, they are not considered legally capacity. They don't have legal capacity rights, and therefore are denied access to their money, benefits, and the government holds the benefits in trust fund for them, but they don't have access to that. So I'm curious, in terms of Peru, if you have a similar problem in terms of people putting in institutions
Not
and
really.
orphanages.
As developing countries, we don't have services at all. So we don't have so many institutions, we don't have so many special schools, we don't have services in general. So that was kind of the opportunity aspect of the process. So we had children still living in institution, but the number is around 200. In a 10 million country, we still need to work on the institutionalization there. We had around 500 adults with disabilities living in mental health institutions. The Ministry of Health is already committed with the institutionalization process, which is not very difficult because the numbers are low. So it's not a big issue. The big issue is more what is family doing with person with disability, and how bureaucrats will interpret the civil code to deprive them to access services.
This is Meena from Nepal. Just I would like to follow the question from the first gentleman. You mentioned participation and engage of persons with disabilities. In initial, you mentioned the intellectual disability. Just I would like to know the person with intellectual disability or parents with intellectual disability you engage in the committee and other discussion like that.
I won't be able to give you percentage in terms of representation across the sector, but I would say that we were working directly with the main organization, Persons with Down Syndrome and families, but also we engaged at some point organizations of autistic persons to kind of support the process. They didn't support full commitment, but they got engaged. And I think it was an issue of when you have weak organizations, how you ensure representation. And that was kind of a big issue, especially when you are coming with a process that is especially driven by civil society. So it was mostly a few groups of organizations that are organized that want to put this on the agenda, driving the process. So I would say we didn't engage enough with people that are not represented by organizations, and that's most of the people. But then it was difficult to ensure that with the resources we had. I think when the process is driven by the government, you have better chances to do a broader participatory approach. But at the same time, I think we got to work with the biggest ones. So not only in terms of persons with intellectual disabilities, but also psychosocial disabilities, but also the umbrella organization that joined the process later, they were the more representative. So we work with what we have. But it's true, I mean, we don't have any deaf-blind organization working beyond NGOs. We don't have organizations of persons with dementia. So there are a lot of things that are not already in place to work with. So we had to deal with that. And then, true, that was kind of a compromise at some point.
Thank you. And I know there are other people who want to ask questions, but I'd also like to leave time for the presenters from Georgia, Georgi and Tamar. And I will hand over the floor to you, and we can have some time for questions and answer after their presentation.
Thank you. My name is Tamar Nadiradze. I represent Coalition for Independent Living, Tbilisi, Georgia. Georgi, right next to me, the chairman of Coalition for Independent Living. At this point, Georgi will be the main speaker, and I will help Georgi with translation from Georgian into English because his English is really poor. He would not be able to understand anything. So I'm here to help and to fill in some more information in case he forgets something.
მოგესალმებით ყველას, ქართულად.
So greetings to you all in Georgian.
კარგია რომ მომიწვია ესეთ შეხვედრა და ჩამოხდა ეს არის ძალიან მნიშვნელოვანი, ძალიან ბევრი ინფორმაციას ვიღებ.
I don't know. So we're really happy to be here today. We are listening to a lot of interesting presentations and information.
ჩვენ გავამახვილებთ ყურადღებას იმაზე თუ რა ხდება დღეს საქართველოში და რა ხდება ყოფილ საბჭოთა კავშირის ქვეყნებში ინსტიტუციებთან დაკავშირებით.
So today we're going to to give you a brief picture of what's happening in Georgia in terms of community living and institutions. Also, we will also talk later about the situation in post-Soviet countries in general.
შევეცდებით მოკლე ვიყოთ, იმიტომ რომ ბევრი შეკითხვები იყო.
We'll try to be brief in our presentation. We will talk about legal capacity also tomorrow, about the Georgian reform, the recent reform we had on legal capacity.
რაც შეეხება ინსტიტუციებს, დღეს საქართველოში არის სულ 4 ინსტიტუცია. აქედან ერთი არის ბავშვები, სადაც 29.
So just to give you a brief statistics about the number of institutions in Georgia, there are at the moment 4 institutions for persons with disabilities. One of them is for children with disabilities only. There are 29 children there. And there are 3 institutions for adults with disabilities. In total, there are 207 persons with disabilities in institution. Out of these 3 institutions, which are for adults with disabilities, one is specific. 2 are specifically mostly for adults with intellectual disabilities, and one of them is actually where persons with physical impairments live.
ფაქტობრივად ეს ინსტიტუციები მოქმედებენ თუმცა მე მინდა ხაზი გავუსვა რომ არის ასევე დამალული ინსტიტუციები ასე ვთქვათ BSF ეძახი
So we also have what we call hidden institutions in Georgia which are not on the map, to say so.
იგივე ფსიქიატრიული რომელიც ახლა გამოსულ მახსენა ფსიქიატრულ საავადმყოფოში
like people staying in psychiatric hospitals, which are also institutions. We cannot really call any other name for it. There are also children who have some development or intellectual issues who live and who study at boarding schools, it was called before. Now these schools are called public schools, but actually it's just a different name for an institution. So although these children who are in these public schools, they have, to say so, more liberty to go somewhere over the weekend and to spend more time outside the school, but still it's still just an institution. It's just a lie. So generally in post-Soviet countries, including Georgia, the approach and understanding of what institutions are and why they are there is very wrong, to say so, because even the DPOs think and believe that institutions are the right place for some of the people with disabilities, and what else can we do? This is the only way we can take care of them.
როცა ჩვენ სახელმწიფოს ველაპარაკებით, რომ ინსტიტუციაში ყოფნა ცუდია, მათ უნდა მიცეთ დამოუკიდებელი ცხოვრების საშუალება და ასე შემდეგ, ისინი აპელირებას აკეთებენ იმაზე, რომ აი მაგალითად გააკითხოს არავინ არაფერს.
And when we talk to, our organization and other DPOs, when we try to convince the government that it is wrong to have institutions and we have to support community integration of these people, the counter argument we always hear is that there's no demand coming from these people themselves who are in the institutions. They're not asking for anything. They're happy there. So let's keep them happy.
მართლაც შეგვიძლია ესეთი სიტუაცია?
And we pay frequent visits to the institutions. Just recently, the guests from here, like Bruce and John Wadage and Gerard Quinn, when they were all in Georgia, they also visited some of the institutions in frames of our project. And we really came across such stories from the people in the institution themselves, them wanting to stay where they are.
დუშეთი და ჩემთვის გასაკურრი ერთ-ერთი ინსტიტუცია არის დუშეთი, სადაც არამენტალური პრობლემები, ფიზიკური პრობლემების ადამიანები და ისინიც კი ამობდნენ, კი, მაგრამ აი სად წავიდე და ეხოს გაპარია, მე არავინ არ დამეხმარება.
And there is this specific institution which is located in Dusheti, close to the capital city, which is where mainly people with physical disabilities live. And talking to them too, they were also very indifferent and very hopeless, and they didn't really see any other option for their life rather than being in that institution.
ფაქტობრივად ჩვენ მოგვიწია ლაპარაკი, როგორც კი დავუწყეთ ლაპარაკი, მე სამუნამ ვთქვა, როგორ აი შეიძლება ესე მოითხოვო, ეს კანონი არსებობს. როგორც კი ამაზე დავიწყეთ ლაპარაკი,
But this kind of response is, of course, down to their awareness and their understanding of their rights. As soon as we started talking to them about their rights, we started talking to them about the CRPD and all the lots of options they must have for their life and they must demand. Then they started to understand and to kind of stand up for their rights.
ეს ჩვენ ვიცით კარგად კონვენცია, კანონები, რაღაც ფორმები, ადამიანები რომელიც ცხოვრობენ საერთოდ არ წარმოუდგენიათ, რომ საერთოდ ეგეთი რაღაც კანონები.
So the DPOs and representative organizations of persons with disabilities might know the CRPD by heart and might understand everything, all the legal implications, all the legislations of the countries. The actual people, persons with disabilities, especially those who live in institutions, don't have so much understanding and so much information about the mechanisms for their rights protection. So first of all, it is important and vital to trigger this demand and this anger, to say so, inside these people themselves, people with disabilities who live in the institutions.
არის ისეთი ადამიანები, აქ ბევრი იყო ლაპარაკი მხარდამჭერის ასისტენტზე, ბევრი იყო ლაპარაკი იმაზე, რომ სად დავაბრუნოთ ოჯახში, როგორ არიან ხალხი, რომელსაც სიამოვნებით დაბრუნდებოდა იგივე სახლში, რომ ყავდეს ასისტენტი. მაგრამ ფანტაზიის დონეზეც კი არ წარმოუდგენია მას, რომ ამის მოთხოვნა შეუძლია და ამასახელო დაუფინანსებოს.
Like they can understand, and they want to. Some of them, they also want to go back to their families, or want to live with their families, but they just cannot understand how it is possible. They cannot understand and do not know that the government should be and must be providing services of personal assistant. They don't know about the services which are already available in the country, let alone creating and demanding new services like personal assistance.
და არც ის არ არის, რომ მიუღებობაა მათ ოჯახებში. მათ ოჯახებში მაგალითად ეს დედა ყავს, უბრალოდ მოხუცებული დედაა და ვერ მოუგდის, თორე ოჯახში იცხოვრებდა ის და აქედან გამომდინარე იძულებულია რომ ინსტიტუციაში.
Like because some of them, there is for example, one lady who prefers, in inverted commas, to live in the institution because she has an old mother. Her old mother has very poor health and she cannot help her. Her mother cannot help her with her daily activities, and she lives in the institution because there are carers who can support her. So it's not like the families are against having persons with disabilities with themselves, but also there is this problem of families being unable to provide support for their family members with disabilities.
არის ესეთი მომენტები, რომ გამოსავალ თვითონ ეხლა ინსტიტუციაზე, რომელზეც მე ლაპარაკობ, იქ დაახლოებით 49 კაცია, მაგრამ არის გამოსავალი თითქოს და პატარა ჰომბეისებში გადას 5 კაციან. ესეთი შემოთავაზება?
So the biggest number of people that live in the institution is like maximum 69, 65. The institution that we are mainly talking about at this moment, which has mostly people with physical disabilities, there are only 45. And now there is a growing tendency in Georgia to move to a small home group type of places. They call it home-based support and home-based services, where only 5 or 6 persons with disabilities live.
არა იქაც ვერ მიყავს თქვა ძიმე შეზღუდვის მქონე ფიზიკური პრობლემების მქონე ადამიანი, რადგან იქაც არ აქვს იმდენი რესურსი, თანხა და
But these small group homes cannot accommodate people with physical disabilities. Again, due to lack of resources, they don't have enough resources to have personal assistants who could help and support people in wheelchairs, for example.
და ამიტომ იქაც უფრო ისეთი ხალხი ცხოვრობს, ვინც უფრო მობილურია და შეუძლია სოციალურ.
And so they are forced, these small group homes and the organizations who are running such homes, their criteria is to first focus on people who have, let's say, milder disabilities and who are more or less mobile and have mobility skills and can take care of themselves alone.
ძალამაზი ქვეყანა მე ჩემთვის მაინც გასწრებ. ძალამაზი ქვეყანა პატარა ქვეყანა 4 მილიონამდე ხალხი ცხოვრობს, მაგრამ ძალიან არ ადაპტირებულია მობილურობის შეზღუდვის მქონე ადამიანებს.
So we have about a population of 4 million in Georgia, and while Georgia is a beautiful country, or at least we like to think so, it is very inaccessible.
ჩვენ ძალიან გვიჭირს იქ ცხოვრება. აბსოლუტურად ყოველ დღე ფაქტობრივად ბევრი ხალხი რომელიც ინსტიტუციაში არ მიდის, ფაქტობრივად შინაპატი მარია.
And because of that, there are lots of people who are not in institutions, but still they are staying in their homes all the time. So they are prisoners. So it does not really mean that if we have a few number of people in the institutions, all the other people are enjoying life as they should be.
ამიტომ ორი უკიდურესობის ქვეშ ხდება ადამიანი. ერთი რომ თქვა იყოს ინსტიტუციაში, მეორე იყოს შეიძლება ოჯახში, თქვა ისეთ 4-5 სართულიან ბინაზე მეოთხე მესამე სართულზე საერთოდ ვერ გამოვა, მაგრამ სახში იქნება.
So it's like they don't have much choice, persons with disabilities in Georgia. Either they have to choose to be in the institution or to stay home on the 5th or 6th floor of an apartment building where there's no lift, no accessibility, and years pass without them coming outside.
ჩვენმა ორგანიზაციამ კოალიცია ერთიანობს 28 სამთავრობო ორგანიზაციას და ფაქტობრივად საქართველოში შეზღუდული შეცდომის მქონე პირთა პოლიტიკას ვქნით, დავიწყეთ უკვე ლაპარაკი ამერიკელების დახმარებით, ჩვენი მეგობრების დახმარებით, დავიწყეთ ლაპარაკი უკვე ხელისუფლებასთან, ქონდა გვაქვს პირველი მცდელობები სამართლებრივი ადვოკატურების.
So that's a brief background about the institution, about the situation in Georgia. Just a few words about our organization. We are an umbrella coalition of 28 disability organizations, including the deaf, the blind, women with disabilities, parents of children with disabilities, youth organizations, including regional organizations. So we just started taking first steps and approaching the government of Georgia to start thinking and planning about closing down the institutions, again with the help from our friends here.
ბევრი პრობლემა ახლა ის პრობლემები რომელიც მე უნდა ჩამოტოლო ყველამ კარგად იცით ალბათ ეს პრობლემები არის ის რომ ვთქვათ იგივე ინსტიტუციიდან გამოსულ ადამიანებს პირველი რაც უკვე თქვი ასისტენტის საშუალებით ვერაფერს ვერ იზამს მეორე მენტალური პრობლემების მქონე ადამიანები რომლებიც ვთქვათ წამოვლენ მათ იმ სოციუმში ჩართვა ძალიან გაუჭირდება და ეს ყველაფერი ერთმანეთს ეხება და
So, of course, we don't think that the institutionalization can happen over the night. There are a number of issues that have to be dealt with before that. Again, availability of personal assistant in the country. Also, we have to find a way how to help people with intellectual disabilities get integrated into society and start living, to say so. So there are a number of, a long list of problems that have to be identified and to which we have to find solutions before we get rid of the institutions.
ჯერებთან თავის მოხსენებაში ახსენა, რომ კარგია როცა თანამშრომლობ სახელმწიფოსთან და ფაქტობრივად ლაპარაკობს თავაზობ რა უნდა გაკეთო, იმიტომ მათი მხრიდან ისმის ყოველ მე მზად ვარ ცვლილებებისთვის. მე მზად ვარ, მაგრამ აი მითხარი როგორ რა ფული საიდან გავაკეთო.
And like Gerard said in his presentation, it's we need civil society organizations need to work with the governments and need to help the governments and bring solutions to the table, because at least in Georgia, in the case of our government, they are willing to cooperate and they are willing to improve the situation. They're just asking help and support. They're asking, how can I do this? Can you help me find a way? Because they're mainly their questions are with what money should I do it? What kind of programs do you think we should implement? And civil society organizations also, it's not like we have a recipe already prepared.
ფაქტობრივად ჩვენც უკვე ვიწყებთ ფიქს, როგორ შეიძლება მართლა შევცვალოთ არსებული სიტუაცია. მაგალითად, მე ბავშვებსაც მინდა ცოტა გავამაკვირო. ბავშვი სულ 29 ბავშვია შარდ დარჩენილი, ფაქტობრივად შვილ ბავშვთა ინსტიტუცია მომავალსაც ალბათ USAID-ის მხარდაჭერით, USAID არა, UNICEF-ის მხარდაჭერით ალბათ სულ გაუქმდება. მინდობით აღდაში გასული ბავშვებზეც არის პრობლემები, მაგრამ ის ბავშვები 12-18 წლის გახდება.
Like what happened in case of closing down the institutions where children would live is that the government, and there is this ongoing childcare reform in Georgia, which is mainly supported by the UN agencies, including UNICEF. And they successfully closed the institutions where children with disabilities, not only with disabilities, but other children would live. There were 5,000 children in orphanages. And now for children with disabilities, there is only one institution where 29 children live. But what happened in case of children is that, and they introduced programs like foster care. But what happened was that when these children turned 18, the government had no vision or no plan or no program what to do with these already adults, and their foster care program ended, and they have no plan.
და მინდობით ალბათ იმისა, ვისაც მიწა იმას 600 ლარს აღწევენ და თუ მშობელი, რომელსაც ბავშვი ყავს, არ ჩააბარებს ის ინსტიტუციას, მაგ ფაქტობრივად არ ეხმარებიან.
And the government has really very wrong and crooked, to say so, policy of supporting parents who are providing foster care. For example, to say in more detail, so if there is a family who is willing to take a child with disability under foster care, the government pays this family 600 lari, which is around $300 a month. But when the biological family of the child wants to keep the child and does not want to give up their children to the institution, the government does not support such family at all. So this is very wrong. We have no idea how they came up with this plan. And when we ask a question about this policy and this decision, they say, well, they are their biological parents. It's their responsibility to take care of children without being paid for it, which is absolutely wrong and not a good justification of what they decided to do.
მიბმული ამბავზე ვერ მუშაობს სახში ოჯახში შემოსავალი ვერ მოხდა და აქედან გამომდინარე ძალიან ბევრი სიტუაციებია.
So that's just a list of difficulties we're trying to that we wanted you to know before we say how we are trying to deal with this. So first of all, we think that in case of Georgia LS, to increase motivation, to create ground for getting rid of institutions is to go to the court. At least that's what we decided to do. And we actually now have one case of one of the ladies who lives in the institution, and we took her case. She has a son who was in foster care, but now he turned 18 and he's living with some friends and some strange people because he does not have strangers, sorry, because he does not have any support or any plan for his life. And so we took the case of this lady and we applied to the court. Well, first we applied to the city council, city municipality where this lady spent 10 years living before she was institutionalized. But we were rejected because the city municipality rejected to provide housing for her because they said, first of all, that 10 years was not enough time for to ask for an apartment in that city. And also they said that they didn't really, to say in simple words, they didn't really believe that she was disabled. And she was, in the first place, she was institutionalized because she was with disability. But in the end, what the local municipality was saying, that the healthcare ministry, which put her up in the institution, which put her in the institution because she was disabled, was lying, and she was not really disabled, and she was there. So anyways, it is a very difficult process. We have appealed this decision, right? Our lawyers are here, and I'm not a lawyer, so I need to consult with them all the time. And we have, and we also have a plan to, if the court also issues such kind of inadequate decision or ruling, we want to take it to on a broader stage, to say so, and conduct big community and public education events and draw much attention. We have also, in terms of our organization, is also doing a great work in terms of promoting independent living and the concept and philosophy of independent living in Georgia. We are translating. Actually, one of the materials we translated and distributed was on the myths on independent living. There is this great brochure prepared by European Network on Independent Living, and we translated it into Georgian. And we want every member of the parliament or every civil servant and every person with disability institution to have that brochure to look at very simple facts, which is a myth and which is a fact. For example, the myth is that independent living means being self-sufficient, or independent living means living alone, completely isolated. We are also drafting and working. Started talking and working with the healthcare ministry to draft a strategy of their view and plan on the institutionalization. Of course, we don't want to rush into any reform or any actions before there is a plan in place, like our colleague was saying, to have a long-term strategy and long-term view rather than just like they did in case of children, just get rid of the institutions and then have no plan or no strategy how to deal with these people.
მარტო ცენტრალურ სამინისტროს არ მინდა რომ ელაპარაკოთ აი ამ დეინსტიტუციონალიზაციის თემაზე. იმიტომ რომ მუნიციპალური ორგანოებიც უნდა იყოს ჩართული, ჩვენ მათთანაც ველაპარაკებით და ვეუბნებით რომ ინსტიტუციაში ჩაბარება ჯობია რომ სათემო თემშივე მოუძებნოთ მათ ადგილი, ამაზეც ვიწყებთ ლაპარაკს და შეიძლება ვთქვათ მუნიციპალიტეტმა თავის წილი სოციალური პასუხისმგებლობა აიღოს, წარმომიდგენია ესე რომ ეს იყოს ვთქვათ საწყებია სოფლის მეურნეობაში შემდეგ დასაქმების ასე ვთქვათ პერსპექტივით და ასე შემდეგ და ასე შემდეგ. ეს ლაპარაკი და ეს მიმართულება ეხლა იწყება და ჩვენ ეხლა
So we're not only targeting the central government, to say so, and only the healthcare Ministry of Healthcare and Labor, which is now the key responsible agency for disability issues. We are also wanting to involve local decision makers and local municipalities in this process, for local governments to take their own part of and own portion of responsibility to provide housing, to provide employment opportunities, and to provide other services that can be easily provided and funded by the local budgets. So we want this process to be decentralized, to say so. And just one argument we are using when talking to decision makers as well as other civil society organizations and local municipalities is that the government, when we requested information from the healthcare ministry, how much is spent on one person in an institution per year. And it is about more than 12,000 laris, which is about $6,000 or $7,000. This is for one person in 1 year, and these people have been living in institutions for tens of years, and just imagine how much money the government is spending on the institution. They would easily rent or purchase an apartment and provide housing for these people to live a normal life. So, well, provided that they also support other services. So this is one of the key arguments we are trying to use when talking to not only to the government but civil society, because they also need to understand the need to close down the institutions.
დიდი ხნის დავიწყებული ან არასოდეს არ იყო იმიტომ ზოგიერთი მაგარი დავთასახლებიდან ისდებოდა და
So we would like to finish with what we started, is that first of all, the demand has to come from persons with disabilities in the institutions. They have to remember what it was like to live with their families, or in the cases of those who have spent all their lives in institutions, starting from infantry homes and then infants' homes and then orphanages and then to the adult institutions, they need to be shown other options and shown perspectives for their lives, because they need to be more aggressive to say so, and they need to get angrier with the government to demand for their rights, and we need to make them angry. Thank you.
Thank you very much, Georgi and Tamar. We have about 10, maybe 15 minutes for question answer, and I see you're already jumping the line here in front. Okay. And all right, we've got a lot.
Firstly, thank you very much for that excellent presentation. I'm really delighted that you brought up this issue, and I think we shouldn't forget that there are still so many people with all kinds of disabilities living in awful situations in institutions right across the world. On the positive note, there's so much evidence on this issue, and there's so much experience in places like the US, the UK, and other countries. So it's really important not to make some of the mistakes that have been made. Ireland, we were late coming to this issue. I ran the national project on deinstitutionalisation. We published the report in 2011. We still have in excess of 2,500 people in institutions here. You gave a figure of what your government are spending. The average cost per resident in Ireland, when I published the report, was €106,000 per person per year. That was the average, yes, and there are some much higher. Sorry? Yeah, and rising. So I think the main message I would give to you is not to make the mistakes that some of us have made, and there are lots of people out there with good evidence to make those arguments with your government, and if we can help in any way, just to offer that help. If you're in touch with Gerard, he's probably already given you our report, but if there's any way we can help with your fight, please come back to us. It's very important that this kind of work is happening in countries.
Pass right behind you. Go ahead with your question. That wasn't really a question, more of a comment, so we'll move to the next.
So I may go ahead, right? Well, thanks for your presentation. My name is Farhat, I'm from Kazakhstan. You know, like in our country, we have a system of disability advisors on different levels, on the mayor's level, minister's level, like regional levels. Well, you said that your government sometimes doesn't know how to deal with this or that situation, and you're trying to help them, giving some advice. So I was wondering, didn't you try to establish such kind of system of disability advisors on different levels so that representatives of disabled persons would be able to directly advise to mayors and ministers how to deal with this or that situation, or what services, programs, or practices establish on spots? And if you did you have any results about that? Thank you.
მე კარგად ვიცნობ ყაზახსტანში იქ სისტემას ასწავლებს.
Georgi knows well most of the systems working in most of the post-Soviet countries, including almost all the countries, including Kazakhstan. We also know that there are a lot of institutions in Kazakhstan, right?
Yeah.
And also, as far as we know, they have not really started talking about closing the institutions. Maybe the advisors are not providing good advice.
და ჩართულობაზე გამომდინარე 33 მუხლიდან და აქედან გამომდინარე ჩვენ რა თქმა უნდა ვილაპარაკებთ და რჩევებს ვიცეთ. მარტო რჩევის მიცემაც არ არის, ჩვენ უნდა რეალური გზა შევთავაზოთ ეფექტური ფინანსებზე გათვალისწინებით.
So we're
დიდი მადლობა გადაუხადო იმისთვის რომ მითხას ფაქტობრივად თქვენი სერვისი ძალიან ძვირი ის და თქვენ აპირირება ამაზე შეგიძლიათ გააკეთოთ. We are also, our areas of activity, I mean, of our organization is very broad, and we also work with local municipalities. Actually, we work on implementing Article 33 of the Convention, trying to support implementation of this article on the local level. We are working with almost all of the local municipalities across Georgia to establish local disability consulting councils. Some of them are already established. Others are just working on having some paperwork left to do. But the thing is that having advisors at local municipalities just to check the box is not enough. And we need to be able to provide realistic solutions and mechanisms. Advice is one thing, but actually pointing to some kind of solution, to some kind of experience or practice, international practice, is another thing. Thank you for your comment, and also thanks to you from Ireland. I'm sorry if I couldn't hear your name. We would like to hear more about Irish experience as well as other countries. And I think the argument that you're using is that the cost of service in Ireland is higher than in Georgia, and that is a strong argument in favor of the institutionalization.
Hi, my name is Lee, and I actually work for the health services in Ireland. I was appointed after there was hidden cameras put in one of our institutions which filmed the residents there being abused by staff. And it was shown nationally on television, and the following day I was appointed as confidential recipient to our health services. And it's my job to act as, I was one of the safeguarding people put in place for people who are in institutions in Ireland. I would agree institutions have no place in the world, but there are many kinds of institutions, as you pointed out so well. You can be stuck in your own home and see nobody for years, and so that's another kind of institution. You could have been talking about Dublin when you were talking about the 10-year waiting for housing. Accessible housing in Ireland it's a very small number of accessible homes in Ireland. We are working, I think, only not fast enough at closing the institutions. We call it decongregating. But there's no point putting people into small group homes if those group homes are being built in the middle of a field 3 miles from the closest village, because it's still an institution, it's just smaller. So integration of people is very, very important. And if myself, or I'm sure Christy, or anybody else from the Irish community can be of any help to yourselves, we would be more than happy to share any information with you.
Thank you. We will definitely reach out to you. Thanks.
Judy and Bruce had a question. Then we have a question on the left.
So I was just wondering if in Peru or in Georgia, are you working on the issue of people who are basically incarcerated in their homes because of a variety of reasons? And if so, if you could briefly explain what you're doing.
რა თქმა უნდა მუშაობ ჩვენ სპანერ ძალიან ბევრი ასე ვთქვათ ზარი შემოდის ჩვენთან ორგანიზაციაში ფაქტობრივად როგორც უკვე ითქვა ცდილობთ რომ დამოუკიდებელი ცხოვრების ცენტრი ვიყოთ საქართველოში ჯერჯერობით მასეთ სტილს ვიჭერთ აქ ყველა კონსულტაციით ჩვენ ვიკავშირდება არის პრობლემა რომ იქიდან გამომდინარე რომ ეხლა კონვენცია უკვე რატიფიცირებულია ჩვენ ფაქტობრივად ვცდილობთ არის კეისი ისეთი იგივე რაიონში საჩხერეში გქონდა კეისი რომელთანაც ვცდილობთ როგორღაც მათი სიტუაცია ვასწავლოთ და სასამართლოს მხრით ვაიძულოთ მუნიციპალიტეტები რომ შეცვალოს მათი გარემო და ადაპტირება გავუკეთოს იმ საცხოვრებელ საწოლში. ყოველდღიური ჯერჯერობით ვეკუთვნებოდა.
So, public education is very important aspect to our efforts, and public education does not mean targeting only officials or civil society organizations, but raising awareness of persons with disabilities themselves is very important. And we just started running a law clinic at our organization, and we had a lot of, we kind of used all the communication channels to share information and to spread information about our clinic. And we have received a lot of calls from people with disabilities who are in their homes and unable to live because of poor accessibility, for example. And we already have filed a lawsuit against the local municipality in one of the regions of Georgia, which denied 2 persons with disabilities living on the 2nd floor of the apartment building accessibility modifications. And we actually, the court decision was actually very progressive, and it was successful. The court ruled that the denial of the local municipality for accessibility modifications was in violation of CRPD. And first of all, their decision, what was most important in the court decision was that the denial for the procedures that the local municipality went through for trying to find a reply in response to the demand from the person with disabilities. They were not inclusive of these people themselves, and they did not really encourage participation of DPOs or other representative organizations in their thinking or strategies. So, we have just recently started. Threatening the government and local municipalities with courts and lawsuits, and it's working and it's effective. For example, after that lawsuit in the local municipality in West Georgia, there were similar requests and similar cases in other towns of Georgia, and they were not issuing those unjustified responses anymore, the local municipality. They are taking a more comprehensive approach to say so, rather than just saying, no, we don't have money for that.
και პირველი кейსი იყო რა ჩვენ შევიტანეთ თქვა თქვენ უნარიანობაზე დასმული დისკრიმინაციის კეის დისკრიმინაციის ნიშნით სასამართლო პროცესი არ დამთავრებულა ეგეთი რამე ჯერჯერობით.
And just to mention one more thing, which we will talk more about tomorrow, disability law, case law in Georgia. We don't have such in Georgia. So in the previous days, yesterday, for example, we were talking, the USA has like 40,000 cases or something, and other countries also have a lot of court cases on disability rights. We have just maybe 3 or 4. So it's a new process in Georgia. Just started 2 years ago, probably.
So one question here, then one question there, and then it's lunch.
Okay. So I'd like to ask a more difficult question that is about the role of the church in a country and its relationship to the rule of law and to government power, state power. It's known that in Georgia in Georgia, like in many other countries, the dominant church authorities there are very, very powerful and are supported by, very strongly supported by the people and by the government authorities. And yet there is institutions where disabled persons have been that are under the control of the church, but the church gives no information. The church gives no information whatsoever about the orphanages that they run and what happens to the people inside the orphanages. How do you see prying open information about what the church is doing with with orphans within its system when it keeps it secret, and how that might apply to other countries?
აქტიურად გეთანხმებით, რომ არსებობს ასეთი ფედერალური ინფორმაცია, არსებობს ინსტიტუციები, როცა ფაქტობრივად ვეკითხებით, არასამთავრობო ორგანიზაციები მონიტორინგზე ვერ შედიან, თუმცა შევიდა სახელმწიფო სტრუქტურა, როგორც ჩვენ ვიცით, ინფორმაცია არსებობს ამითი და ვითხრეს, რომ რაღაც სტანდარტებს აკმაყოფილებს, მაგრამ ყველა შემთხვევაში ეგ არის უფრო მეტად ცილად ბავშვებზეა ეგ გათვლილი, ბავშვების ინსტიტუცია არის და იქ მათ შორის არის შემდგომი შესაძლებელი ბავშვები. და ლაპარაკი მიდის იმაზე, რომ ფაქტობრივად სახელმწიფო მაინც ეუბნება, რომ უნდა ეს ბავშვებიც წამოვიდნენ იქიდან. თუმცა პოზიცია ეკლესიის ჯერ თანხმობაში არ მოდის.
That is a difficult question. So we know that there are institutions run by churches, and we know that there may be a couple of thousand children, including children with disabilities. Civil society organizations like watchdog organizations have not been able to conduct any kind of monitoring in these institutions because they have not been able to get a permission. Although some kind of monitoring has done by the healthcare ministry, and the report the healthcare ministry issued says everything is fine there, says the standards are followed. But it received, the information and the report that DRI put out received a lot of public attention. And after that, the healthcare ministry went to monitor the orphanages run by churches. But the effort has not been so active since then. And it's, we don't say, like I asked Georgi again, so what's our solution, what's our plan, what to do? I don't know. It was this frank response, we don't know what to do about that. They are very powerful. So one thing is for sure, any kind of institution run by any kind of, what may be a church or government or an individual person is wrong and should not be there. We are in agreement about that. Everybody has to have a choice. But we don't have a strategy for everything yet. But we're working on it. So.
Just two quick questions. One is after the CRPD ratification, did Georgia develop like a disability law, or is it just on litigation that the CRPD is being recognized? Like, how has the CRPD become part of the law in Georgia? That's the first question. And the second is, you mentioned that the government gave you the expenses per person in the institution. Is there overall like budget monitoring that happens by the disability community in Georgia, looking at all expenses that are maybe not compliant with CRPD and how that can be respent?
კანონმდებლობა ცვლილებები მიღებულია, ეხლა ხან შევიტანეთ დარეგისტრირდა სულ 2-3 დღის წინ ერთი ცვლილებათა პაკეტი, რაც შეეხება ბიუჯეტის მონიტორინგ სფეროში, არ ვიცი ყველა სხვა საბჭოთა ქვეყნებშიც როგორც არის, ისე ალბათ ჩვენთანაც იგივე უბედურება გვჭირს, რომ არასამთავრობო ორგანიზაციები ძალიან სუსტი არიან. მე ჩვენსაც შეგვიძლია და არასამთავრობო ორგანიზაციები თვითონ ბიუჯეტის მონიტორინგში და ამის გამოცდილება ნაკლებ აქვს, თუმცა ომბუდსმენთან შეიქმნა ახლა დეპარტამენტი და ამ დეპარტამენტის მეშვეობით, სადაც საბჭოა იმედს ვიტოვებთ, რომ ეს მონიტორინგის ხარისხი გაიზრდება. ინსტრუმენტი შეიქმნა.
So in terms of legislation, we are actually just yesterday, I think, or a couple of days ago, we registered a package of legal amendments for a number of laws, including laws on general education, higher education, professional, vocational education, also culture, sports, and road safety. So I think it's 10 or 11 documents, and they have been revised in compliance with the CRPD, and they have been just registered in the Parliament of Georgia to undergo all the hearings. We also, a couple of years ago, and John Wadaj helped us about that, we developed disability anti-discrimination legislation, which was before the CRPD was ratified in Georgia, and now it needs, and which was before the legal capacity reform. So that paper needs to be updated, and then we are still thinking to and planning to submit that draft legislation to the government, to the parliament. That's from the legislation part. As for the budget monitoring done by DPOs, unfortunately DPOs in Georgia, like in many countries we've been hearing recently here, are not strong enough to do budget monitoring as well. They don't have instruments or knowledge how to do it. They are mainly, 6 months ago there was a disability monitoring group set up at the Public Defender's Office. They have a disability rights department, and under this department there is a disability consultation group, a group of experts, and they are planning to do budget monitoring as well, but we have not seen any reports yet. They are working on it, so we'll see. But in general, budget monitoring is a difficult, tough task for DPOs in Georgia.
Thank you, Georgi and Tamar, and thanks all for your good questions. Obviously, there's a lot of work to do, but we can't do it on empty stomachs, and I can smell lunch. So it's now lunchtime. Please come back by 2 if you want to hear very exciting Catalina Devandas, Special Rapporteur on the Human Rights of Persons with Disabilities. Thank you.